an unforgiving path across the country, numbers show it is especially devastating to one group, African Americans.
When you look at the proportion of people who get into serious trouble and die, again, it's going to be disproportionate towards the African Americans. The proportion of people who get into serious trouble and die, again, it's going to be disproportionate towards the African Americans.
And you've heard the stats in New York City. Hispanics represent the majority of deaths. In Milwaukee County, blacks are 25% of the population, but almost 50% of the cases and 75% of the deaths. So what's going on? Well, it's alarming, but it's not surprising that people of color have a greater burden of chronic health conditions. African Americans and Native Americans develop high blood pressure at much younger ages. It's less likely to be under control and does greater harm to their organs. Puerto Ricans have higher rates of asthma, and black boys are 3 times as likely to die of asthma as their white counterparts. The chronic burden of medical ills is likely to make people of color, especially, less resilient to the ravages of COVID-19, and is possibly, in fact likely, that the burden of social ills is also contributing. Social distancing and teleworking, we know, are critical, and you've heard Dr. Birx and Dr. Fauci talk about how they prevent the spread of coronavirus, yet only 1 in 5 African Americans and 1 in 6 Hispanics has a job that lets them work from home. People of color are more likely to live in densely packed areas and in multi-generational housing situations, which create higher risk for spread of a highly contagious disease like COVID-19. We tell people to wash their hands, but a study showed 30% of the homes on Navajo Nation don't have running water. So how are they going to do that? In summary, people of color experience both more likely exposure to COVID-19 and increased complications from it. But let me be crystal clear. We do not think people of color are biologically or genetically predisposed to get COVID-19. There is nothing inherently wrong with you, but they are socially predisposed to coronavirus exposure and to have a higher incidence of the very diseases that put you at risk for severe complications of coronavirus.
For those of you who may not understand the American media system or how it promotes its propaganda campaigns, or even why it would promote propaganda towards certain groups of people living in America, first you have to understand that at its core, America is still a very racially charged republic. All of our institutions and social constructs in society and how we see ourselves as Americans is all rooted in race, ethnicity, and cultural lineage. And it's nothing that we citizens of America have created for ourselves, but it is the system in which we live. And that system was created and is well maintained by our former and current day government officials. So I will begin by saying that America is first and foremost racist within itself, and that is why it would seem to some that Americans are overly obsessed with race. That is true. And it is so because our government and our elected officials are overly obsessed with using race as a means of handling business and politics. One must know this if you are going to understand why the media perpetuates the messages that it does. Recently, it has been reported in the media that African Americans have the largest group of infected individuals and that the government wants to begin taking data that will show each racial group's COVID-19 counts. So now they want to make the new face of COVID-19 African American because they say that our predisposition to coronavirus is due to risky and unhealthy lifestyle choices, such as drug abuse, alcoholism, and such. But what the media won't tell or show you is that the majority of drug overdoses in the U.S. are coming from the white communities, infested with opium addiction, and not Black America. The rest of this video is going to show you the addiction and drug war of current day white Americans, which also proves that just because you're Black doesn't mean that you are more susceptible to getting coronavirus than anyone else who is white or brown. It just isn't true. There are other factors related to that statistic, like the lack of quality health care and the finances that it would cost for an uninsured person to pay for just one coronavirus test. Instead, they want people to believe that the vast majority of us are alcoholics and drug addicts, and that's why some of these inner cities are being affected at the high alarming rates. Please check the links in the description box. There are countless documentaries that have been done by respected news and media outlets recently about white America's drug addiction problem.
The Surgeon General, Jerome Adams, said there when the question came up regarding African Americans, and then he makes this point about don't do drugs, don't do alcohol, things along those lines. Then Yamiche asked him, because a lot of people have been offended. In fact,
and it's even more important that in communities of color, we adhere to the task force guidelines to slow the spread. Stay at home if possible. If you must go out, maintain 6 feet of distance between you and everyone else, and wear a mask if you're going to be within 6 feet of others. Wash your hands more often than you ever dreamed possible. Avoid alcohol, tobacco, and drugs. And call your friends and family. Check in on your mother. She wants to hear from you right now. And speaking of mothers, we need you to do this, if not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your pop-pop. We need you to understand, especially in communities of color, we need you to step up and help stop the spread so that we can protect those who are most vulnerable.
Your thoughts on what he had to say? And again, Surgeon General, did he slip up? Did he make a mistake? Was it smart to later have to walk that back and clarify it?
No, it wasn't a slip up or a mistake. It was stated, and I took offense to it personally, and several different things. For one, Dr. Fauci and President Trump, you can't tell if you're not the targeted population of an insult, then you can't tell us whether or not we can be offended by it. Point number two, being that African Americans typically are always given this stereotype that it's our lifestyle choices that are leading to us having these incidences of worse outcomes in health, but yet we at this point have a national crisis of an opioid epidemic, and it's not treated in the same way, and it's not spoken to in the negative light in the same way as what impacted the Black and brown community. The third point was that he mentioned that he talked to the NAACP 3 weeks ago. Now, 3 weeks ago, we were dealing with deaths of maybe 500. Today, we have deaths of over 18,000. And so if you haven't reached back out to the NAACP or the Congressional Black Caucus, of which I've been in contact with Congresswoman Bass and Representative Robin Kelly, who've been absolutely fantastic. They literally hold town hall meetings pretty much every week. There's something going on of where they're trying to reach the constituents to say, what do you need so we can form these policies? So if you haven't reached out to these groups in 3 weeks, then I'm going to need you to go ahead and make a schedule. And then the final point is you cannot talk about all these comorbidities that they are linking to and saying we're at higher risk for. You can't talk about those unless you are willing to also get on that stage and point out and address the systemic racism that has set up every platform. And if we're talking about drugs and alcohol and the lack of mental and social support, then talk about the fact that we don't have any hospitals and clinics that are put into our communities. Talk about the fact that if we're talking about these chronic respiratory illnesses and asthma that our children are dealing with, then talk about the fact that industries are targeted towards the Black and brown and the lower income level communities and polluting our air and polluting our water. If you're going to talk about hypertension and diabetes and obesity, talk about the fact that there's no sidewalks within our community or that there's no eateries and we have this food apartheid where we can't buy any fresh food and groceries, but we can go to the corner store because that's all that was put there from the redlining from 1930s on. So including from his president. So if we're talking about all those things, I hold Dr. Adams responsible as a fellow anesthesiologist, for one. But I hold him responsible as take away my white coat. At the end of the day, I'm a Black woman trying to do what's best for my Black community. And what I know about Black people is that we're honest people. We work hard to promote community at all fronts. We've always banded together to take care of ourselves and to take care of not only ourselves, but other people. And to suggest that we are the cause of our own hurts and not that we are the victims of the system that was set up for us to fail in the first place, I feel like it's personally a slap to the face to the African American community that will always be there to support you.
I am kind of ashamed to admit, but I'm honest enough to say, yeah, I've been down the beaten path before, trying to clean up, and I have been for a minute now, just trying to do better and stay that way.
A month out of rehab, and Rocky Coon is determined to break the grip of addiction that's devastated his family.
My mom died. She died of a car wreck, but addiction was her best friend.
They've received a prescription for a very strong opioid medication, legitimately from a doctor.
Prescriptions, so like Vicodin, Percocet at any different kind of milligram, morphine pills, Oxycontin, methadone pills, Valium, Klonopin,
And those are all prescriptions?
Oh yeah. I thought I was gonna be somebody and drugs ruined my life.
Since the evictions of the first two encampments down in Kensington, the overdoses have skyrocketed.
Damn, what a shame.
Oh, I know this guy.
Don't waste that on him.
What do you think, man? Your buddy says he's fine. I'm telling you what I'm thinking. He's not fine at all.
My main concern right now when I go out there is to make sure that nobody is overdosing, because that's all you see.
Ready? Where's the needle? Oh, where's the needle? In his hand. In his hand. Right hand. Ready? All right. Oh, there he is. There he is. There you go, buddy.
No. Educating those out there in addiction about harm reduction, where they can go to get help, explaining the concept of Narcan and traveling in pairs, explaining the concept of getting off the streets. It's become a very daunting task. But when you see a group like my team, you see a group of people who are fighters, and they're out there and they're fighting a battle that needs to be won. And in Kensington currently, we're losing still.
Claiming more lives than car crashes or even gun violence.
Where's 108?
Tear open package and remove hands. It is now safe to touch the patient. Start CPR.
More than 900 Americans from all walks of life now die each week from opioid drug overdoses.
Let me pull him out. Get him on the ground.
It's a national crisis triggered by painkiller pills.
He's not breathing.
But I want the American people to know the federal government is aggressively fighting the opioid epidemic on all fronts.
Over the last 20 years is that painkiller and heroin addiction has gone mainstream, Main Street, and it's grown disproportionately among the so-called Anglo population, which is why deaths from overdoses, different types of overdoses, can now on a national scale be higher than deaths from traffic accidents or gunshots. This is a white thing.